Good morning. We'll now begin the Q&A. As a reminder, we're joined today by Dr. Dave Choksi, Health Commissioner, Dr. Mitch Katz, President and CEO of NYC Health and Hospitals, Dr. Ted Long, Head of NYC Test and Trace, Georgia Pastana, Corporation Counsel for NYC Law Department, Rachel Loeb, President and CEO of NYC Economic Development Corporation, Vicki Bean, Deputy Mayor of Housing and Economic Development, and Janelle Doris, Small Business Services Commissioner. Our first question for today goes to Marcia with WCBS.
Good morning, Mr. Mayor. How are you today?
Good, Marcia. How you been?
Good, good. I wonder if you're coordinating this with the governor of New York State, and we can expect to see her adopt the steps that you're taking today as well.
You know, Marcia, I spoke with Governor Hochul this morning, gave her an update on what we were doing. And I said, look, based on all of our experience, including with the Key to NYC, with the restaurants, with the indoor dining and entertainment, that we really were confident this was the right next step and that private sector employers would work with us to get this done. So I told her why it was the right thing to do for us now. We had good conversation. I'll certainly let her speak for her own approach here. And let me emphasize, I respect the governor. We work well together. We talk regularly. There's a lot of coordination and communication. And I appreciate that. That's been really, really helpful in our efforts to keep people safe. Go ahead, Marcia.
Second question is this, Mr. Mayor. I know that there's been some concern about private sector people coming back to work in January, and I know that there's been some concern expressed by the business community about the number of people who want to come back because they like telecommuting, et cetera. Are you afraid that these new mandates, especially in the finance sector and in the tech sector, which have been the fastest growing parts of New York City, are you afraid that this is going to slow down their return to the offices, which could affect, other small businesses, et cetera, in the city?
It's an important question, Marcia, and I'll tell you, I actually feel very good about what the impact will be. I'll tell you why. Because I've heard from so many business leaders, including in those sectors like finance and tech, that the best thing for them is for the government to lead the way. Well, we did lead the way with the approach to our own employees that's been incredibly successful. We led the way with the Key to NYC, reaching with the indoor dining, with the indoor entertainment, showing the larger private sector that in those parts of our economy it could really work for everyone, and it has. And a lot of them recognize that. But it's always better for the private sector if the government sets a single universal standard. So they don't have to have the reality with their employees of saying, hey, this is something we're going to do on our own. This is what a lot have actually asked for in the private sector. One standard that applies to everyone. I think you're going to see a lot of people embrace it. You're going to see a lot of people make the decision it's time to get vaccinated. There's also obviously many people are vaccinated. So for them, they're coming back to the office, they're already vaccinated, that's done. So I really think we're going to see this actually help ultimately, just like you heard when it comes to any other business environment. If people know where they go is going to be safe, it actually encourages them to come back to the office.
Our next question goes to Juliet with 1010 Wins.
Yes, good morning, Mr. Mayor, and everybody on the call. So I guess my question is, how do you plan on enforcing this with private business? Will there be reports that they have to submit, or will inspectors go to the office? How does that work?
So, Juliet, we're going to work with the different business communities between now and December 15th to put together those protocols. We'll publish them on December 15th, so it's still well before the mandate takes effect December 27th. And look, we have a really impressive body of knowledge now from the Key to NYC. There was a lot of dialogue with the business community in advance. We figured out ways to improve the approach to educating, providing support. We're going to have that call center for any concerns. We're going to work with people. The goal, of course, is to just get them there in a way that works for them. And really, we found with Key to NYC, overwhelmingly, it's gone smoothly. So we'll work that through. We'll put that on December 15th, but I feel we've got a lot of evidence now that this approach will work. Go ahead, Juliet.
Okay, thank you. And would there be penalties for non-compliance?
Juliet, look, it is part of life that there have to be some consequences, but I want to emphasize, one, we'll figure out what makes sense by December 15th when we put out the guidelines. But I want to remind you, and we'll get you the latest facts on this, it's been amazing with the Key to NYC, very few times we actually had to penalize people. We focused on educating, we focused on warnings and helping people figure out how to do it well. There's been very few instances where it got to the point where there had to be any penalty. So it's always a tool we have, but I think the fact is we've already proven that there's a good cooperative way to get this done. We've done it with a big swath of our business community already. And I think this next step is going to be something really the vast majority of businesses are going to embrace and work with us to get done. I mean, you just heard from Nestor, he didn't have to do what he did. He did it because it made sense for his customers and his employees. I think this is going to help a lot of businesses to get it done because it's one standard for everyone.
Our next question goes to James with Pix 11.
And good morning, Mr. Mayor and everyone on the call. Happy New Week.
Happy New Week, James. How you feeling?
Not bad, thank you. Not bad at all. Hope you're well.
Feeling good, man.
Okay, so on with the questions. And maybe this is sort of a follow to Marcia's question. I'm curious to know how much conversation you've had about the private sector mandate with the mayor-elect. I mean, I get that December 15th, you're planning on coming up with certain standards by which businesses have to comply, but it doesn't go into effect, as I understand it, from what you've said, until the 27th of December, which is less than a week before you leave office and someone else does. What is the role of the next administration in enforcing what this plan that you've come up with?
Look, first of all, everyone knows I have tremendous respect for our mayor-elect, Eric Adams, and we talk all the time. We met at Gracie Mansion right before he went on his trip to Ghana. We talked through a variety of pending issues. I gave him the initial thinking on this. We had another conversation late this Friday while he was over there. I gave him the full update on what we're doing. Look, he has always said he understands right now there are urgent threats facing our city, and the mayor's job is to protect New Yorkers. And that's my responsibility up to the very last minute. He understands the urgency of the situation. I'll let him speak for himself about what he thinks about each approach. But he has been tremendously clear that he respects the healthcare professionals and their guidance. He respects the science and what it tells us. And I can tell you, James, our healthcare leadership absolutely believed this was a necessary act because of Omicron and that likely very high level transmissibility, because of the colder weather, and because of the holiday gatherings. That's a triple threat, and we need to be aggressive. So I think the merit of this will become very, very clear. Go ahead, James.
Thank you. And yeah, following up on your last point, and I'd love to hear from you and maybe one of the medical professionals on the call. Can you talk about, you've said this is a preemptive strike against Omicron, but certainly Delta is overwhelmingly the predominant problem at this point, as far as we know. Can you talk about how much these new measures that you're announcing are preemptive and how much they are reactive, particularly noting that the indicators are rising? You did also point out that hospitalizations, for instance, went above the number one for the first time in quite a long time.
Yeah.
Reactive versus preemptive.
Yeah, the reason I say preemptive is it's time to do something even bigger before Omicron asserts itself here, before we get into the holiday gatherings, before it gets to the really colder weather. It's actually been surprisingly nice weather the last few weeks, but that won't go for too much longer. We know that. So it's preemptive because we needed to do something bold quickly and get ahead of all of this. These are major threats looming, and we see it with the numbers rising because of Delta. We see it with the nature of Omicron as we understand it right now. That's a lot all happening at once. So to give you the medical thinking, I'm going to turn first to Dr. Katz and then to Dr. Choksi, and we have had really just conversation after conversation trying to figure out the right tools. And what I've heard from the medical team loud and clear is vaccination, 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 and anything that gets more people vaccinated. That's what we need to do. That's what we have to do right now. Dr. Katz first.
Yes, sir. I think you have it absolutely correct. One of the things that I find so interesting about this particular COVID virus is how good it is at finding the unvaccinated. Despite the fact that we are at such a high level in New York, this virus is amazing at finding those people who are unvaccinated and making them sick. And so everything that we can do to get everyone vaccinated will make a huge difference. While there are still cases among people who are vaccinated, they are overwhelmingly mild, people having some symptoms, sometimes testing positive without any symptoms. But for people who are unvaccinated, we continue to see in our hospital very serious disease, people on ventilators, people dying. We desperately want everybody vaccinated so that we do not have to have any more death in New York City. We have gone through enough. Thank you, sir.
Amen. Dr. Choksi.
Yes, I agree. This is an all of the above approach because it's an all hands on deck moment for New York City. We're seeing enough about Omicron that is concerning, that warrants the bold steps that the mayor announced today. And we have a chance to blunt the effect of Delta in the here and now as well. What we do know as the common thread is that vaccination saves lives and it helps us to prevent suffering. So that's the very clear public health rationale for the steps that we're taking today. Thank you.
Thank you. Go ahead.
Our next question goes to Aaron with Politico.
Mr. Mayor, just a couple detailed logistical things about this private employer mandate. So are you talking about all employers? Is that regardless of their size? And is it regardless of whether the employee is in person or remote, or is it applying only to in-person employees?
Aaron, we're going to put out the detailed standards on December 15th. The broad stroke is it's in-person employment. And so remote is obviously different, and essentially that means people working from their home. We're talking about in-person employment. And we're talking about whenever it's more than one person. If someone has a place of employment, they're the only employee, that's a different matter. But if it's more than one person, that's what we're focused on. Go ahead, Aaron.
Oh, great, thanks. And then I'm wondering, so the city's approach to this was to put the employees who are unvaccinated on unpaid leave. That seems just at first brush like the kind of thing that not every small business, unpaid, like those type of leave policies don't necessarily exist. So I'm just wondering, are people going to get fired? Are people going to be on unpaid leave? Like, what is going to happen to the unvaccinated employees at these private businesses?
We're going to work with the business community on working out these guidelines by December 15th. Obviously, there's going to be the kind of thing we've seen throughout all of the mandates, some kind of process made available if folks want to request a reasonable accommodation. That's been a consistent and effective tool. Vast majority of people don't do that or don't end up getting it, obviously, but that's something that will be available. And really, different companies will have different approaches, different businesses. Look, I think, first of all, so many people, thank God, are vaccinated. Let's remember that. They will already be covered. Second of all, a lot more people will get vaccinated because of this. It's been true with every single mandate. So the bottom line is, I don't think there's going to be too many situations where you're talking about someone potentially having to take leave. Bigger companies might do a leave policy, others might do something else, but we've got time to work it through between now and December 15th.
Our next question goes to Elizabeth with Gothamist.
Good morning, Mr. Mayor. I wanted to follow up on James's question about your conversations with Mayor-elect Adams. Can you say when you arrived at this decision and when you had a conversation with Mayor-elect Adams, and why isn't he on this call with you this morning?
Well, Elizabeth, obviously I can't speak for his schedule, and he's overseas right now, but I can say, as I said, I had 2 conversations with him as we were starting to formulate this right before. It was the day he actually was leaving for Ghana. We had a detailed conversation and a more detailed conversation on Friday night as we were perfecting this and working on the final details. So again, I'm sure he'll be speaking to it, but he and every conversation we've had about fighting COVID, he has been really consistent on the point that he is feeling urgency about these new threats, and he understands that my job is to keep New Yorkers safe until December 31st and then hand the baton to him. So I feel very, very good about the conversations we've had and the close coordination that he and I are constantly involved in. Go ahead, Elizabeth.
So this is the season or time of year where a lot of companies are having holiday parties. What would you and your health officials say to these companies who may have unvaccinated workers about holding these kind of gatherings?
Well, I'll start as a layman and then I'll let the healthcare professionals weigh in. I start with get everyone vaccinated and wear masks in gatherings. I mean, I think that's 2 really essential points that cover the core of what we need to do. I think people can still gather, but gather the smart way. Dr. Choksi, Dr. Katz, Dr. Long, who wants to go first?
I'm happy to start, sir, but you're exactly right. The safest holiday gatherings are the ones where everyone is fully vaccinated, and we are encouraging that, particularly as we see cases increase. That is one very concrete way to make them even safer. If there is a mix of unvaccinated and vaccinated people, the precautions that the mayor has mentioned are extremely important. Masking, distancing, making sure that people get tested both before and after a gathering. And the final thing is to keep it as small as possible. If we bring all of these things to bear together, but particularly starting with the foundation of vaccination, everyone can be kept safer. Thank you.
Thank you. Dr. Katz or Dr. Long, you want to add?
I'll just add, I'm a big believer in open windows and outdoor parties. So in addition to all of the things that Dr. Choksi said, I think that's a nice way of adding a layer of protection. Thank you, sir.
Amen. Dr. Long?
Yeah, I would just add that I think as we think about holiday gatherings, this is the success of our Key to NYC policy that we've been a national leader in setting up. We require people to be vaccinated going to certain types of gatherings like at restaurants. And I think for holiday parties, I would strongly encourage employers to think about the success in terms of how Key to NYC has kept our city safe and use those same standards. And again, regardless of vaccination status, I want to go back to one thing that Dr. Choksi said. Get tested before you go to gatherings, especially if they're among people that you don't ordinarily see, and then get tested after the gathering as well. Thank you, sir.
Thank you very much.
Our next question goes to Nolan with The Post.
Hey, good morning, everybody. Can you hear me?
Yeah, Nolan, how you doing today?
I'm doing well, Mr. Mayor. I would just like to start by saying that in a time when the city's facing a new coronavirus variant and there are concerns about access to testing and the rollout of a new mandate policy, and everyone's trying to figure out just how we get on with life amid all this, it is urgent and essential that City Hall take questions from reporters and make you available at every opportunity, and that the dramatic restrictions placed on the press corps and its ability to access you regularly are not helping that cause. And I just want to lead off with that. And I would like to follow that by asking, what exactly is the legal advice that you got in terms of how this is legal? How can the city compel these sorts of conditions upon employment and participating in in-office activities?
Let me just say very simply, as I turn to Georgia Pestana, our corporation counsel, one of the things I'm proud of over the course of this crisis, and it's been a horrible crisis, is that our healthcare leaders have been so constantly answering the concerns and questions, not only of the media, but of everyday New Yorkers, community leaders, elected officials, constantly in these morning press conferences, in endless Zooms and community meetings, that I have regular press conferences and have throughout, obviously, in addition to what I do with WNYC and New York One. We have made it a point to constantly communicate, and we will right up to the last day. And I'm proud of that, and I know a lot of New Yorkers have expressed their appreciation to me. The question of why this makes sense legally and otherwise, the universality is key, Nolan. We believe the right way to approach this is a clear, strong standard for everyone. And the Commissioner of Health has to act when there is a health crisis, and we have seen it deeply over the last 2 years, but now we have these three factors bearing down on us. A new variant, which appears to be very transmissible, cold weather, which we know unfortunately facilitates the spread of COVID because people are indoors, and the many, many holiday gatherings that'll be happening, including family gatherings. Those three together, as I say, that's a triple threat. That's a real cause for concern. Our health commissioner does have the legal right to say, here's something necessary to protect the health of all New Yorkers. But from a purely legal standard, I want you to hear from our corporation counsel, Georgia Pestana.
Thank you, Mayor. You're absolutely right. The health commissioner has an obligation and a responsibility to protect the public health. Here, he is issuing an order that is intended to do just that in a public health emergency. So he has the authority, and it is across the board. So it's not picking one industry over another and treating them differently. So we're confident that this will survive any challenges.
Thank you very much. Go ahead, Nolan.
Thanks, Mr. Mayor. And just to rebut what you said, your administration has done away with technical briefings. It's done away with the ability of the press to ask more than one follow-up question in any round of questioning. And it has done away with the daily briefings, taking them to just 2 a week. So I just challenge, to borrow your phrase, your premise. Secondly, how are parents supposed to get their kids into restaurants for the expansion of the Key to NYC? Are they supposed to carry their kids' vax cards with them, or what mechanisms are put in place to help parents do this?
It's the exact same approach as we've seen with the rest of Key NYC, including for kids 12 to 17, and it's been working perfectly well. Yeah, you've got the apps, you can carry the physical vax card, whatever it takes. But look, this is going to help make sure a lot more kids are vaccinated, but also it's a fair standard that parents will certainly be able to meet.
We have time for 2 more questions for today. Our next question goes to Emma with the New York Times.
Hi, good morning, Mayor. I'm curious also about the legality here. Can you say what precisely is your legal authority to do this? And, you know, the Biden administration tried to do this for private employers with more than 100 employees, and that is currently stalled in court. So what makes you think yours will be successful when his was not?
Really important question, Emma, and of course I'll turn to Georgia Pestana in a second, but I just want to say, look, the Biden administration has been exemplary. What they have done with a variety of mandates and policies has really helped save this nation. Obviously, you know, very, very extensive vaccination effort. What they've done with the military getting vaccinated is astounding. The high percentage now in our military of vaccinated people. They've done so many things that worked and have been in the right direction, and I agree with them on their approach to private sector employers around the country. But we have here an immediate set of circumstances, and we have the legal right of the health commissioner to keep the people of this city safe. That is something that's been proven time and time again. We've been in court many times on a variety of issues, state court, federal court. We have every single time been validated by the courts. When the health commissioner believes there is a pressing public health threat, he has the ability to act in that situation. That's the broad strokes. Now for a more erudite answer, our corporation counsel, Georgia Pestana.
Thank you. The Commissioner of Health, as I said, has the authority to issue a mandate like this to protect the public health, and his authority to do that has been upheld time and again. The trouble that the Biden administration has run into in court doesn't really apply here. Those injunctions were issued because there are questions about the authority of OSHA in one case, and CMS, which is the agency that regulates Medicare and Medicaid providers, authority to issue the mandates that they did. Here, I don't believe there is any question that Dr. Choksky has the authority to issue this mandate, and it's the across-the-board nature of it that is also, I think, makes it defensible.
Thank you. Thank you. Go ahead, Emma.
A few more questions on specifics. So to be clear, there will not be a testing option as an alternative, and folks would need one dose by December 27th?
That's right. There's not a testing option as an alternative, and anyone who is unvaccinated would need one dose by December 27th. And as I said, on December 15th, we'll issue much more detailed guidelines. But we want to reach everyone who is not yet vaccinated. And this is a clear, strong standard that allows us to do that.
Our last question for today goes to Katie with the city.
Hey, good morning, Mayor de Blasio. I want to ask about two agencies that are not private necessarily, but are also not under your purview. It's about CUNY and the MTA. There's currently not a mandate for CUNY employees. I know there's one for students. I think they have an option to get tested, and the same for the MTA. There's no mandate. So have you spoken with the governor's office about this, and does this extend to them, this new mandate?
The mandate is for private sector employers. We'll get all the details out again by December 15th, but it does not apply, obviously, to the state government or state-related entities like CUNY and the MTA. And look, Katie, I've said it for now probably a couple of months. I believe across this country, private sector and public sector mandates are necessary. I think they're helpful. They've been proven to work. We now have a really, extensive experience with our schools, with our healthcare system, what we did with the rest of our city workforce, most recently, the Key to NYC. Every single time it's worked. And the fears that originally existed were proven wrong, thank God, and they've been just extraordinary growth in the number of people vaccinated. Each mandate has just caused a lot more people to get vaccinated, simple as that. So I really hope all levels of government will use them more and more going forward. Go ahead, Katie.
So have you had, well, I don't want this to count as a second question. I know you're really strict about that, and we have limited time. I guess you'll continue conversations with the state on CUNY and MTA. But my other question is, it just seems that I want to know, I guess, more details about how you've discussed this with private sector companies. Some people have announced today they were very surprised by this mandate. Business leaders around the city seem to be very surprised by this. There seems to be a limited amount of time between now and the 15th. That's about 9 days getting this together. And then the enforcement really happened under the next administration. So just if you want to talk a little bit more about how many conversations you had with the relevant stakeholders before making this announcement this morning on, I will say, on cable television, when you could have said it on the local TV or you could have announced it here, but that's just me splitting hairs.
Thank you for everything you said. The conversations with the private sector go back months and months about the different approaches. We based our thinking on a lot of factors. The most important is the health and safety of all New Yorkers. So even though, of course, we want input, the most important thing is what's going to keep people safe. And our healthcare leadership was adamant that this was a step that we could and must take. We know from extensive conversations over months with private sector employers what their concerns are. And we also know that many of them have said that when mandates are in place, it actually helps them. When the government leads, it is helpful. We're going to have time to work with the private sector on what the exact standards would be. That's between now and the 15th. Given everything we've worked on together before, that's enough time to solidify these standards. And then from the 15th to 27th, time to get ready. And remember, thank God, such a high percentage of employees are already vaccinated. That helps a lot. But I'll tell you, the number one thing I've heard from the private sector now over many months is that we must avert shutdowns. We must avert the huge restrictions we had last year. We've got to get continuity and move forward. And when the government acts and sets the example, it helps the private sector. So, of course, we did this for our employees first before we're asking others to do it for theirs. And that's been such a powerful example, and it's worked. So I feel very good about the fact that the input we've gotten over months and months about the general direction has been clear, and this is borrowing from that input, but much more importantly is based on the single most important factor, what's going to keep New Yorkers safe as we now face a new threat. And this will do that. This mandate will make a huge difference. It'll be in effect quickly, and it's going to help protect people then for months and months to come, because everyone gets even that first dose, starts on the pathway to being protected, and that helps protect all of us. So with that, everyone, again, I thank every New Yorker who has gotten vaccinated. I thank Nestor and so many good people like him who have made that decision to turn to their employees and say, it's time, everyone. This is going to help everyone take that next big step. And if you have not gotten vaccinated, today's the day to do it. If you're looking for that booster, it's out there. Go get it today. Keep us all safe. Thank you, everyone.